everybody for zooming in today for this presentation through the East Hampton Library. We have Norma Cardone, who is going to talk about the new changes with Medicare. There's all these different parts, Part A, Part B. What does one choose? So if you have any questions, Norma's been involved in that area for quite some time and has in the past done programs in person for us. So without further ado, I'll turn over the floor to Norma.
Thank you. So good afternoon, everyone. My name is Norma, like Steve said, and I am a senior healthcare coordinator. And what that means is every year I help hundreds of seniors, whether they are aging into Medicare or whether they are looking to switch their plan. That is what I do. So I'm going to go over the different parts of Medicare with you, and then I'm going to go over the changes in Medicare Part D with you that have taken place for 2022, yes. So if you have any questions, if you look in the chat, you will see my email address and my telephone number. And you could at any time call me or email me and I will answer any questions that you may have. Okay. If you have questions during the seminar, you can also interrupt me and I'll answer any questions that you may have. If you think of something later on that you wish you would have asked me and you didn't, you can always call me or email me and I'll be very happy to answer your questions. So right now I'm going to go over the different parts of Medicare with you. Medicare Part A is 80% of your hospital, and it is free to anyone who has worked 10 years or more, or if your spouse has worked 10 years or more. Medicare Part B is 80% of your hospital, of your doctors, and that is, everyone pays a fee for Medicare Part B, and that fee is $148.50. That's income based. So if your income is higher than norm, then you will pay more for Medicare Part B. If you pay more for Medicare Part B, you will also pay more for Medicare Part D. Medicare Part D is your prescription drug coverage. So that is based on your income as well. Again, that's a sliding scale. If your income as a married person, as a married couple is over $170,000, you will pay more for Medicare Part B. If you are single and your income is over $85,000, you will pay more for Medicare Part B. If you pay more for Medicare Part B, you will pay more for Medicare Part D. Medicare Part C it's kind of like a bundle. So it's a Medicare Advantage plan. Medicare Advantage plans combine Part A, B, and D together. And it's known, like I said, Medicare Part C. You always have to pay your Medicare Part B premium in order to enroll in a Medicare Part C plan. Medicare Part C are Medicare Advantage plans. They are plans offered by private companies, and you are now agreeing to go by the rules and regulations of that plan. Although you are always part of original Medicare, if this plan says you must pay $10 to see a primary care doctor and $50 to see a specialist, that's what you're agreeing to. You are agreeing to pay, let's say the plan says you have to pay $300 for a CAT scan or an MRI. That's what you're agreeing to. So some of these plans, you might pay a little more for something than you would on original Medicare, but these plans all have something that original Medicare does not, and that is what is known as a maximum out-of-pocket expense. Original Medicare does not have a maximum out-of-pocket expense. So you will be responsible for 80% of unlimited if you just decide to be on original Medicare. So 80% of unlimited. So that means if you're in the hospital for a week and that hospital bill is $200,000, you are now responsible for $40,000. You are responsible for anything that Medicare does not cover. Medicare Advantage plans have a maximum out-of-pocket expense. So if you're in a PPO, the maximum out-of-pocket expense can be anywhere from $7,000 to $11,000, whether or not that's based on whether or not you stay in network or go in and out of network. There are HMOs and PPOs. A PPO is preferred provider organization. That means that if you go out of network, you will pay a higher copay but you have the option of going out of network. If you stay in network, you will pay a smaller copayment, but again, you have the option of going in and out of network. An HMO is a health maintenance organization. Everything you do must be in network. If you go out of network, you are going to assume 100% of the cost if you're in an HMO. If you're in an HMO, you can't say, okay, well, I'm going to go out of network and Medicare is going to pay the 80%. They will not do that. Medicare will not pay the 80%. You have agreed to sign on this Medicare Advantage plan. You have agreed to do everything in network. If you go out of network, you are now assuming to pay 100% of the bill. I think before I said you're responsible for 80% of the hospital. I'm sorry. I don't know why I'm reviewing what I said in my head. You will be responsible for 20% of the hospital bill. So again, if that hospital bill is $200,000, you will be responsible for $40,000. On a Medicare Advantage plan, they all have that maximum out-of-pocket expense. Again, that helps cap your medical costs. So those are your Medicare Advantage plans. Medicare Advantage plans also offer other advantages. They will give you hearing. Some will give you hearing aids, some will give you dental, some will give you vision, or they're optional benefits that you can add on to them. Medicare Advantage plans are always equal to or better than original Medicare. They have optional benefits that you can add on to them, which are not included in original Medicare. So a lot of people will opt into a Medicare Advantage plan because, as you know, with Medicare, all of your preventive care is zero. So if you're in a Medicare Advantage plan and you're going for your routine physicals and things, cardiovascular screening, colonoscopy, mammogram, all of that would be zero, but you must use an in-network facility, whether you're in a PP or an HMO, and you must be going within Medicare guidelines. So if Medicare says you can have a colonoscopy every 5 years, Medicare will pay for that colonoscopy and you will not pay for it. If the doctor tells you that he wants you to come back within 2 years, that is now considered not preventative, but diagnostic. So you will pay a copayment for that procedure. Does anybody have any questions so far on Medicare Advantage plans? Medicare supplement plans work a little differently. Medicare supplement plans are offered again through private companies. They do not include prescription drug coverage. So now you will be paying a copayment for the Medicare supplement plan and your prescription drug plan. Medicare Advantage plans, you pay for services as you may or may not use them, and they have zero or a very small monthly premium. Medicare supplement plans have a large monthly premium, but you are paying in advance for services you may or may not use. The most popular Medicare supplement plans are Plan N and Plan G. It used to be Plan F, but they did away with Plan F. You can still get Plan F if you were eligible to join it before 2020. Plan G has taken the place of Plan F. It's exactly the same thing. The only difference is one time a year, you will have a $203 deductible, but everything else is zero. On Plan F, there was no deductible. So what they did is they lowered the cost of Plan G, and now you will have the one time a year deductible of $203. So on Plan G, you would pay the $203 deductible, and then you will have no additional co-payments or co-insurances for the rest of the year. You can go to any doctor, any hospital, anywhere in the United States. As long as they accept Medicare, they accept that plan. On Plan N, there is a one time a year $203 deductible, and then only when you go to the doctor, you can have up to a $20 copay. Everything else is zero. CAT scan, hospital, MRI. Again, you can go to any doctor, any hospital, anywhere in the United States, as long as they accept Medicare, they accept that plan. Now, there are some doctors who do not accept Medicare. If they don't accept Medicare, they won't accept a supplement plan or an Advantage plan. Those doctors are known as concierge doctors. You pay them a yearly fee. You have access to them all year long. But if you wind up in the hospital, that's a separate payment for you. So it's very important that you should know whether or not your doctor accepts Medicare. Medicare supplement plans do not cover dental, vision, or hearing aids, and you cannot add them on. Some of them will include a gym membership. By law, Medicare supplement plans are the same across the country. Plan N is Plan N from New York to California and with every carrier. The only difference is the monthly premium. Every company can charge a different premium. Some are a lot more expensive than others for the same exact plan. So it's very important that you do your homework and you know what the plans cost per carrier. So does anybody have any questions on supplement plans? Okay, so now I'm going to go over Medicare Part D. Medicare Part D is a prescription drug coverage. Prescription drug coverage works the same whether it is part of a Medicare Advantage plan or whether it is part of a standalone prescription drug plan. Okay, so Medicare allots you for 2022, it's going to allot you $4,430 for prescriptions. And what that means is that's the dollar amount that they are saying that you can spend on prescriptions. And that's a cost shared between you and them. So this is where people get very confused with the donut hole and everything else. Has anybody here ever fallen in the donut hole? Okay, so I'm going to go over what the donut hole is. So stage 1 is the deductible phase. That's where you pay 100% of the cost of your drugs before the plan becomes effective. Most drug plans exclude tier 1 and tier 2 drugs from the drug plan deductible. Stage 2 is the initial coverage phase. This is when you share the cost of your drugs with the drug company. Both you and your insurance company will pay for medication costs until you reach $4,430. So what that means is when you go to the pharmacy, if you pick up a drug and you're paying $100 for that drug, but the actual cost of that drug is $200, they're not deducting the $100 that you're paying for that drug. They're deducting the $200 from that $4,430. Once you've exhausted the $4,430, you are in the coverage gap, which is also known as the donut hole. So that will end once you've paid out of your pocket $7,050. Once you've paid $7,050 out of your pocket for prescription drugs, then you're in the catastrophic phase. When you're in the catastrophic phase, you will pay $9.85 for the cost of your drugs, or $3.95 for generic drugs, or 5% of the cost of the drug, whichever is greater. When you're in the donut hole, you will pay 25% of the cost of brand name drugs. Most plans will cover you in the donut hole for tiers 1 and tier 2 because they're usually not subject to the drug plan deductible. So has everybody here heard of Epic? Epic is additional prescription drug coverage that comes from the state of New York. If your income as a married couple is $100,000 or less, you qualify for Epic. If as a single person, your income is $75,000 or less, you qualify for Epic. Epic has 2 plans. One is considered a fee plan, and one is considered a deductible plan. They put you on the fee plan if your income is under $23,000. And what that means is they will charge you a small fee for Epic for the whole year. And once you reach your drug plan deductible, then Epic kicks in. And even if you're on a drug that's $2,000 a month, you will only pay $20 for that drug. Also, if Epic puts you on their fee plan, they will pay any Part D portion of your premium up to $39. So you're wondering, why would Epic charge someone with little income, charge them a fee to be part of Epic? But as you can see, the benefits of Epic kick in right away for anybody whose income is low. If you are not qualified for their fee plan, they put you on their deductible plan. Epic does not add anything to the cost of your drugs or to the cost of your plan. What it does do is it keeps track of every dollar you spend on prescriptions, including your drug plan deductible. They will apply all of the money that you spend on drugs and on your drug plan deductible towards your Epic deductible. Once you reach your Epic deductible, then any drug that you take that's over and above what $20, you will only pay $20 for it. So Epic is a great benefit to have. If you don't already have Epic, I'm going to give you the telephone number to Epic. So the telephone number for Epic is 1-800-332-3742. And like I said, if you don't have Epic, or if you know seniors who don't have Epic, get it. It's a wonderful benefit. The other thing that Epic does is it entitles you once a year to what's known as a special election period. With this special election period, you can change your plan one time a year, any time of the year, even though it is not open enrollment or annual election period. So annual election is October 15th through December 7th. That's when you can change your plan 7 times during 20 times. You could change your plan every day during that time. The last plan that you enroll in is the plan that will be effective January 1st. January 1st through December 31st of the following year. If you qualify for a special election, such as being part of Epic, if you move, if you lose Medicaid or get Medicaid, those are all special elections. If you qualify for a special election, you can change your plan one other time throughout the year. If not, you will not be eligible to change your plan until the following October. So that's another great benefit of Epic, is it gives you that guarantee that you can change your plan one more time throughout the year. So again, the telephone number to Epic, I see Steve put it in the chat, is 1-800-332-3742. And that is really a great benefit. So if you're entitled to Epic, please get it.
If anybody has
Does anybody have any other questions?
any questions, or if anybody'd like to raise their hand, use the raise hand feature, or feel free to unmute or type in the chat. Norma will answer your questions.
So I see Kathy looked like she was asking a question, but I don't hear her and I don't see anything in the chat.
If anybody would like to unmute, they could just unmute. The mics are open.
Oh, okay. I've been trying and they had been locked. Hello, Norma. I am in Oklahoma and I really like the sound of the Epic, but do they have anything comparable elsewhere?
Okay, so 13 states have state pharmaceutical programs, but I'm not sure if Oklahoma is one because I'm not licensed in Oklahoma. I am licensed in 14 states, but Oklahoma, unfortunately, is not one of them. So I'm really not familiar with the laws of Oklahoma. But if you're computer savvy, you can just Google Oklahoma State Pharmaceutical Program, and it'll come up. If it has one, it will come up. I know New Jersey has one. Pennsylvania has one. Obviously, New York has one. But if there another way to lower, are you taking very expensive prescription drugs?
That was going to be part 2 of the question. I'm a military veteran, so my drugs are militarily paid, except for the deductible. Not a deductible. There's a co-payment. And it's minimal, but it does add up when you're talking $5, $10, $15 a prescription, and you're taking 8, 10, 12 prescriptions.
Oh, yes, it does. So another way that you can lower the cost of your drugs is a lot of the companies will give you coupons for their drugs. Obviously, you call them up and they will ask you some financial questions. but a lot of companies will give you coupons for their drugs, especially if you're on a very high cost drugs. You see those commercials when they say, if you're taking your prescriptions and you need help, call
Right.
us. They really do help you. Another way is, but this might not benefit you, but it would benefit other people because you're getting your drugs from the VA, correct?
Correct.
So this might not help you, but there's something called GoodRx. I don't know if that's an app that you download on your phone, on your smartphone. And what GoodRx does is you can actually compare the price of the cost of your drug through your prescription plan and what it would cost on GoodRx. And sometimes it's cheaper on GoodRx than it is on your prescription drug plan. I always do that. You know, it even tells you what pharmacy to go to, and it would be cheaper at that place. I always check GoodRx before I pick up my prescriptions.
I've seen the commercials. It looks like a really good idea.
It is, and it's just an app. Now, it doesn't take place of your drug plan, and by law, everyone must have a drug plan. You don't have to be on a Medicare Advantage plan or a Medicare supplement plan, but by law, everyone must have a prescription drug plan. If you do not have a prescription drug plan, the government will penalize you 1% for every month that you could have had a drug plan and didn't take it.
Wow.
And that penalty stays with you forever. So it's very important that everyone has a drug plan. VA is considered credible coverage. If you're working, employer coverage is considered credible coverage. But coverage like GoodRx and discount drug plans, those are not considered credible coverage. So even though you do not take prescription drugs, you should enroll in the lowest prescription drug plan there is. This way, at least you know that you will never be subject to the penalty. Another thing I advise people never to do is to call those numbers that you see on television or to call a company direct. And the reason for that is if you call a company direct, let's say you call company X direct, I'm not allowed to mention companies because this is an educational seminar. So let's say you were to call company X. They are going to sell you on a company X plan, whether or not that plan is good for you. They're not going to tell you, oh, company Y has a much better plan for you, or you would be much better off going with company C, because obviously they want to enroll you in their plan. So never call a company direct. Also, if you call the number on television that you see Joe Namath and Jimmy Walker represent, what that number does is agents will buy into that number and they'll say, I'm on call from 12 to 2. And they route you to the next available agent. And what that person will do is enroll you in a plan that they represent. If they only represent one plan, that's what they will enroll you in. So it's very important that you do your own homework or that you deal with an independent agent, such as myself. But there are plenty out there. You don't have to deal with me. But at least you know that you're getting someone who represents all of the major carriers. And by law, they all have to compensate agents the same. So no one, if you deal with an independent agent, they're not going to steer you towards one company because by law, they all have to pay, they all have to compensate them the same. So at least you know that you're getting the plan that's right for you. And if you're dealing with a good agent, they'll keep in touch with you throughout the year. You can reach them at any time, and at least it's helpful to you.
Plan, is that considered a D plan, or do you have to have a D and then Epic?
You have to have a D and then Epic. Epic
Okay.
only works in conjunction with the Medicare plan. You cannot have Epic in lieu of your Medicare Part
Okay.
D. It only works with your Medicare plan.
Okay, thank you.
You're welcome.
We have a question. Do you have any recommendations for supplement plans?
That all depends on your doctors and your health. So there are plenty of supplement plans out there, and they're offered by most carriers. And the difference is the premium and how often you go to the doctor.
To re-explain the difference between plans G and N.
Okay, so Plan G Both plans have a $203 deductible. So once a year, you'll have to pay $203 deductible. Usually your first doctor will charge you that because he knows that that's what you have to do. On Plan G, after you reach your $203 deductible, you will have no more co-payments for the rest of the year. You can go to the doctor every single day. You will not have any more co-payments. On Plan N, you will have co-payments only when you go to the doctor of up to $20. The doctor cannot charge you more than $20, but he can charge you up to $20. Everything else is exactly the same as Plan G. CAT scan, hospital, MRI, blood work, durable medical equipment, that's all zero. Medicare will never call you, ever. Medicare also will not endorse, will not say to you, oh, go with this company. You'll get phone calls and the caller ID will say Medicare, and that's these companies. They're putting the word Medicare in their company name. So when you get the call, you think it's Medicare calling you. Medicare will never call you, and Medicare itself will never endorse any plan for you to enroll in. They'll never say, oh, go with this plan, go with that plan. If you ever get a call from Medicare and it's, or somebody who's telling you they're a Medicare specialist, that's not true. Medicare will never call you. Agents will call you, but Medicare will never call you.
Best thing to do with the phone calls is just let everything go to voicemail, and then later on cipher through it.
Yep, that's exactly what I do. I get plenty of phone calls. And funniest thing, my son, every time he gets that phone call from Social Security, we've noticed illegal activity. He calls me in a panic. I'm like, Michael, it's spam. Please stop calling me. They're not coming after you. So I do the same thing. I let everything go to voicemail, especially if I don't recognize the number.
Does anyone have any other questions regarding the constant changes with Medicare, or any other questions?
So it's based on your income. So I think $30,000 up to $40,000 is like $1,000 deductible. But every dollar you spend on prescriptions goes towards that Epic deductible. Once you reach your Epic deductible, then you could be on a drug that's $2,000 a month. You'll only pay $20 for it. So Epic helps people when they go into the donut hole, or if they have very expensive prescription drugs. I have a client who goes into the donut hole and is already in the catastrophic phase the first month of Medicare. So Epic is very helpful to him.
Norma, I'm going to be 65 next year. And
Okay.
so I should start 3 months beforehand to apply, or?
So you can enroll in, Medicare. That is your initial enrollment period. 3 months before your birthday, the month of your birthday, and 3 months after your birthday. So you can opt into Medicare Part B. They will make it effective the first day of the month of your birthday. So if your birthday is in January, they'll make it effective January 1st. If your birthday is the first of the month, they'll make it effective the first day of the previous month. So if your birthday is March 1st, they'll make it effective February 1st. If you have employer coverage, there's no need to enroll in Medicare because you'll be paying for Medicare Part B. If your company has 20 or more employees, some companies do not require you to enroll in Medicare. Some companies do. You really should always check with your HR department to see if they're requiring you to enroll in Medicare Part B. Some companies require you to enroll in Medicare Part B, but they'll reimburse you the cost of Medicare Part B.
We have one question. Can you go over what the donut hole is again?
So the donut hole, so I'm going to read it to you. Because I have it written down in a way that maybe you'll understand it. It's easier to understand, because that's the most confusing part of Medicare, is the donut hole. So the coverage gap begins after you and your plan have spent $4,430 for covered drugs, and ends when your out-of-pocket cost reaches $7,050. During this gap in prescription drug coverage, you may pay more for your prescription drugs. In this stage, you will pay a maximum of 25% of the plan's cost of brand name drugs. You pay no more than 25% of the cost of generic drugs, and the plan pays the rest. Any medication-related deductible discounts you receive on covered brand name drugs, coinsurance, co-payments, and the amounts you pay in the coverage gap count towards the $7,050 limit. So the donut hole is when you're in between the $4,430 and the $7,050. That's considered the donut hole. During that time, you're going to pay a lot more for prescription drugs.
Yeah, we have another question. When shopping for Advantage plans, how do you know what the better plan is?
So it all depends on your doctors and your medications. So what you need to do when you're going for a Medicare Advantage plan is you need to find if all of your doctors are in network. If you have 10 doctors and 8 of them are in network and 2 of them are out of network, you might want to consider a PPO because that gives you the advantage of going in and out of network. If all of your doctors are in the plan and the HMO has lower co-payments and lower co-insurances, some people don't mind being in an HMO because all of their doctors are in network and there are lower costs in an HMO than there are in a PPO. But again, if you do choose to go out of network, you are now assuming 100% of the cost. So it's important to make sure all of your doctors are in network and all of your medications are covered by that plan, by that Medicare Advantage plan. Also, if you are ever prescribed a drug that's not on your plan formulary, your doctor has to write a letter of medical necessity, and then they put it on your plan formulary. Not every company covers every drug. By law, they have to have 2 drugs in every therapeutic category, but they do not have to have, if there's 100 drugs to treat high blood pressure, they don't have to cover all 100 drugs, as long as they cover 2 of them, but you cannot be denied a drug. So if your doctor says, hey, it's medically necessary that you take this drug, he has to write a letter of medical necessity and the company will put it on your plan formulary. They can request that you try another drug that's known as step therapy, where you try another drug first, and then if that drug is not good for you, then they cover the drug that your doctor is saying that you need. Also, if you're on a lot of tier 4 medications, let's say, tier 4 drugs are very expensive. Some companies charge $100. Some companies charge a percentage of the cost of a tier 4 drug. So it's very important that you check that if you're on a lot of tier 4 drugs. You can also write to the company that you are enrolling with and ask for a tier reduction. So they'll take one of your most expensive drugs and lower it from a tier 4 to a tier 3 or a tier 3 to a tier 2. They won't do it for all your drugs, but they'll do it for at least one of your drugs. Also, it's important to check what tiers your drugs are in every Medicare Advantage plan. On one plan, they may be a tier 3. On another plan, they may be a tier 4. That could be the difference of $50 a month. Also, it could be a tier 2 in one plan, which could be 0, and tier 3 in another plan where now it's 47.
That you are independent that can help people go through
Correct.
Right. Is there a cost for your service?
No, my services are free to everyone. I get compensated by all the insurance companies. And like I said, by law, they all have to compensate me the same. So I'm here to make sure that you're in the plan that's right for you.
Excellent. Thank you.
I wish I would have asked this. You can call me at any time. The telephone number is my cell phone number. You can reach me at any time, evenings, weekends, especially this time of year. I work 7 days a week. So you can call me anytime with any questions and I'll be happy to answer them for you.
I'd
Norma,
like to,
Norma,
oh,
thank
sorry.
you. I was on another call through another place and they had, someone explained the Medicare procedures, but you did an excellent job. I have much more understanding with what you said than what they said.
Oh, thank you. I really appreciate that. Thank you so much.
Thank you, Norma, and I thank everybody for zooming in on this presentation. And I hope everybody has the best of luck in their searching for their perfect plan.